All right. No more Mrs. Nice Guy. Not really, but hang with me. So, in this video, we are getting into some sales stuff. If you are in a place where you feel like you are struggling to sell physical therapy or your particular service without feeling like pushy or icky, or maybe, like you have new patients and clients coming on, but they are not sticking around, they're there for one or two sessions and then they're ghosting you. If that is happening, it's not that your clients don't need help. It's that there's something about the way the initial conversation is going that is not being led properly. And so today, I really want to take you through a few different mindset shifts that are really genuinely helping the students that we work with in the DPT to CEO program. And they made a huge impact on the way that I do sales as well. And I want to walk you through these because once you implement these different mindset shifts in the way that you lead the dialogue that you're having with your clients, you are going to see your revenue skyrocket. So let's dive into these so that you feel confident in making sales of your service without feeling icky or pushy. So, first concept, and this is something that I think comes up with like almost every single physical therapist or healthcare provider that we've worked with, is the difference between like soft selling or soft talk and actually prescribing a treatment plan. And I think that this comes from a place of we all are very compassionate people, right? Like when we are in healthcare, like you love to take care of other people, you love to help them, you love to be nice, you love to be kind. And when it comes to getting into selling services, for some reason, like the default setting that we have is that if we offer to sell services in exchange for money, that we're doing something harmful. And so like we feel bad about it. And then that causes you to be very soft when it comes to pitching your services. And what ends up happening is that most people are not going to stick around and pay you. Most people are not going to complete a plan of care, and most people are not going to get the help that they need. And so like when it comes to what the sales sound like, and I'd love for you to comment down below if this sounds like you, because it's something that I've spoken to a few of our students recently about, and that's also why my assistant coach Sam and I were doing a sales workshop for our students here in a couple of weeks. So we're gonna like really address this because it's something that comes up a lot for students who are just entering the program. So we're gonna just squash it right from the get-go. But if this sounds like you, I'm gonna give you two examples of dialogue. And if like option number one sounds like you, please leave a comment down below. But there's going to be a major difference here between like option one and option two. So option one, when you like just evaluated a patient and you're getting ready to talk to them about working together, if you sound like this, okay, Sam, based on what we talked about today in our appointment, I know you've been having shoulder pain for a while, and we found like through our testing, probably going on because of X, Y, and Z. And I do see this a lot. I've helped people with this before, and I think I can probably help you. So to do that, like we're probably going to have to work together for a few sessions. I have different session packages that I can offer to you where you'll get like a little bit of a discount, or you can pay session to session. Either one's totally fine. Like what do you think you want to do? That's option one, and that is exactly what I did in probably my first like 4 to 6 months of working for myself. That is exactly how I sounded. So like there is no shame here at all. And I probably still sounded like that for a while after that. Honestly, sales is a skill that it takes a while to figure out. And like unless you have some guidance in walking you through like how a sales conversation should go, it's really hard to figure this out. And that's, why I wanted to make this video about it and see what you thought and if this resonates with you. But anyway, so if that option, like option number one, sounds like you, please leave a comment below because we are going to change it from option one, version one, the old way of selling things, to option number two. So this is how we suggest leading the dialogue now, and it's helped a lot of people feel better about their selling. And of course, there's a lot that goes into it, right? It's more than just the pitch on the evaluation, but specifically like this part is so key and pivotal as to whether your client sticks around. So this is option number two and what we suggest doing now. Okay, so setting the scene. We're just finishing up the eval again with Sam. So this is how I would do it now. Okay, Sam, based on our eval today, we started off the day by talking about the shoulder pain that you had and how it's preventing you from doing bar muscle ups and handstand push-ups, and it's really bothering you, both in the gym but also outside of the gym. I know that your job is fairly labor intensive. I know that you are a roofer. I don't know. I know that you use your upper body a lot at your job, and it's important to you to stay in the gym so that like you maintain your fitness and your strength to be good to go to do your job. And it's also important to you to be able to continue to do your job so that you can continue to make money to support your family. And the shoulder pain that you've been having, it's impacting both of those two things, and it's starting to cause you a lot of worry. Is that right? Is that fair to say? So asking to confirm, summarizing, asking to confirm. And then Sam will say, like, yeah, that's right. And they'll say, okay, cool. And with the different like testing that we found today, we did X, Y, and Z different tests. We found ABC symptoms. They're pretty congruent with having some kind of rotator cuff tendinopathy, I suppose. And I see a lot of athletes in here in my office with very similar symptoms, similar concerns to you as well, where like their symptoms with their shoulder pain, it's really impacting their life both inside and outside of the gym. And through our work together, we are able to come up with an individualized plan to help the symptoms not only go away, but a big part of the way that I treat as a physical therapist is to teach you how to continue to take care of your body should anything come up in the future. And just recently, I worked with another client named Taylor who is having actually the exact same symptoms that you are, with the same pain with the bar muscle ups, with doing handstand push-ups. She also has trouble with snatching too, that I find is really common. And I started working with her back in the beginning of December, and through our work together, now in the middle of February, she's actually able to snatch her 1 rep max without any issue at all, which is really cool. And like she's feeling so much more confident, and so when it comes to what you, Sam, have going on, I feel very confident that I'll be able to help you, get back to doing what you want to do without pain, without symptoms. So if it's okay with you, I'd like to walk you through what the plan would be going from here and what we'd be looking at doing. Is that okay? Sam will say yes. And I'll say, great. Moving right along. And then this part, I personally usually draw a diagram. I like to have the visual, and I walk the patient through like, okay, Sam, based on where we're at today, we're on step number 1. Where we want to get to is, down the road about 3 to 4 steps from here. And between today and step 4, I suppose, where, like you're feeling better, we are going to go through X, Y, and Z. We're going to go through these 3 key things together to help you improve your symptoms and get back to doing what you want to do. Does that plan make sense? Does that sound okay? Sam will say yes. And then I'll say, okay, cool. So, remember earlier I talked about Taylor, your symptoms are so similar. We worked together for 8 to 10 weeks, and we met during that time so far for about 6 sessions. And so honestly, I'd recommend the same for you. I think that will give us like the most time to be the most effective to help you with your symptoms. And so what we'd be looking at is meeting approximately once a week for the next 6 to 8 weeks or so. And in that time, we should see significant improvement to get you back to doing ABC things that you want to do. what the expectations would be, is that you are going to show up to every single session. Every time we meet, we are going to evaluate your symptoms and work on progressing exercises and work on treatment to help make you feel better. And in between each session, you will have homework to do. You'll have exercises to work on your own that will help me best plan your treatment out over the upcoming couple of months here. But through all of that, like I said, I feel very confident we are going to be able to see a significant difference in that time. And so we'll plan to reevaluate in about 6 weeks and see where we're at with everything and make sure that this is the plan that you feel like, is in alignment with where we want to go. So that's kind of wordy, but I'm doing this, off the cuff. But that's now like section 3, I guess, right, of this conversation. Maybe section 4. I'll go back and summarize it in a second. But I'll say, okay, like that's the plan. How does that sound to you? Sam will say, that sounds great. And then I will say, okay, cool. So with a plan, meeting once a week for the next 6 weeks or so, I do offer a 6-session package, which I think would actually be a great fit for you because that's what our plan is already. And it'll actually give you a little bit of a discount per session. So if you'd like, our next steps from here is we can go ahead and take payment for the 6-session package, and then we'll get scheduled. We can even schedule out a few weeks to make sure it works for you, on your schedule, and we'll get going from there. Does that sound okay? And that's it. Ta-da! But, like I said, I think that was a little bit wordy. We could clean that up, polish it up quite a bit. But the main thing that I want you to pay attention to here is the difference between like option 1, pitching on the evaluation, where it was very soft, like here's some different options. We could do this or we could do that. What do you think? What do you want to do? And option 2, pitching on the eval, which is it's very direct. Like I'm very clearly in charge of what is happening there. And there is a clear plan. I am prescribing a plan to the patient in front of me based on my best clinical judgment. And obviously, like it's open to discussion, like it's not like my way or the highway, but I am saying like, this is the offer on the table. This is my best suggestion. Would you like to go ahead and do that? And that's just like, I know if I seek out an expert to help me with something and they give me an exact plan, like, ooh, like it makes my life so much easier to know somebody has a plan to help me rather than me trying to figure out like if it's going to work for me, or like what I want to do. So in that second pitch there, like we talked about at the beginning, like summarizing what they were there for and what problems they have and how it's impacting their life, why they're seeking out physical therapy, getting confirmation on that. Second part is summarizing your findings from the evaluation and getting their confirmation on that. Third part is talking about like a client that we've worked with in the past that has similar symptoms and talking about what the plan is going to be moving forward and how like I typically treat it. And then section 4, I guess, is going over what the timeline is and pitching the package, like, pitching the plan of care and setting expectations and getting confirmation and buy-in that the client wants to do that. I love to just write that out too, like kind of like outline the structure of the conversation so you can practice. And so it's a big difference between like the soft selling in option 1 and what I would call like clinical leadership in the second part. And that's a thing that I think is really important to internalize, is that in this relationship between you and the potential patient, potential client, you are in the leader role. And so you need to be a good leader by being assertive, taking initiative, making the decisions on what's going to happen next. At least in terms of like, your best suggestion, you put the offer on the table and see if the person sitting across from you would like to opt into that offer. Not everybody does, and that's okay. But that is the way that you can present your services so that you are both, like serving the client, helping them get the best results, right? Because if they do a full plan of care, most likely going to get a lot better than if they only show up for 1 or 2 appointments and then fall off. But it's also going to help to serve your business. When you soft sell, so option 1, you're making it about you because you're so afraid of the rejection. You're afraid of what the other person is going to think about you, or if they're going to think poorly of you because like you're trying to sell them something. Versus when you do option two and really take the leadership role, you're making it about the other person because you're offering to help. Instead of backing away from it, you're offering your best clinical help. As the practice owner, you are not just a service provider taking requests. You are a clinician prescribing the best plan of care. And that's how you have to frame the pitch. And the key concept number two, and this is something that I hear Layla Hormozi talk about. I've listened to one of her podcasts recently that I believe talked about this more in terms of managing a team, like the difference between being nice and being kind. And I think that this can apply in sales as well. For those of you out there who want to continue to be nice, I would suggest that we change our thoughts to being kind instead, because being nice means you're telling people what they want to hear or what you think they want to hear. And being kind means telling somebody what they need to hear so that they can get better. And that's a big difference. And I think most of us can agree we want our patients to get better. We want them to feel better. And if we don't tell them what they need to hear, they're not going to get better. And like an example is, with any other doctor, I think, or like with a surgeon, or even like a plumber or a mechanic, if you have a problem, they're not going to be like, oh, like you could get surgery if you want. We could fix your toilet if you want. Your car engine is toast. We could replace it if you want. They're going to be like, look, this is what you need to solve the problem. So do you want to do it or not? And then like the client, right? Like they have the option to say no. Nobody is going to force them to do anything, but they need to know what your assessment is of the problem and what they need in order to get better. And I think like something else that has come up, and I talked to one of my students about it recently, and maybe it was kind of harsh, maybe a little bit extreme, but I think it's important to point out, if you're afraid of putting yourself out there by making an offer, like attempting to make a sale because like you're afraid of getting rejected. You're afraid of what they're going to think of you. You feel like you're an imposter. And like, how dare you try to sell a service for money? And all of those fears, right? If those prevent you from making an offer to somebody, you are going to prevent them from getting the help that they need. And the example specifically that this was coming up for was for a pelvic health therapist. And one thing about me is I'm very passionate about women's healthcare. And what it really like comes down to is, like we're working through her sales stuff, but I was like, look, if you don't get better at making offers to people, at taking the initiative, being assertive, putting yourself out there, offering your services, you are going to prevent, hundreds of women from getting the healthcare that they need because they're out there, you're talking to them, and they need help, and they don't know who to turn to. They don't know what kind of help that they need. And so if you're not willing to put yourself out there, they might not ever get the healthcare that they need. And are you okay with that? And she was like, damn. And like when I really like think about it a lot, I like almost start crying a little bit because like it's real. Your patients are out there and they need help, and they need you to tell them what they need in order to get better. They may or may not say yes right now. That's okay, but they need to know what they need to do in order to get better. And so it's like extremely important that we put our services out there. And the last thing, and I think, this we kind of covered already, but sometimes people wonder about selling packages of sessions, versus like selling session to session. And I think the biggest like worry around it comes up if, like what if I sell a package of 6 sessions and then the patient is better in like 4 sessions? Like, what do I do? Because like I think like we feel bad if like we've sold 2 extra sessions that the client like quote unquote doesn't need. However, the way that I look at it is that there's a spectrum, right, between like rehab to health, fitness, and wellness. And like when a client comes in with a particular problem and a diagnosis, and you say, I think this is going to take like about 6 sessions or so. So let's go ahead and do the package. And they opt into that. By a miracle, they're better in 4 sessions. Great. What other goals do they have? What can we work on next? Like maybe it is doing, I don't know, a bunch of handstand push-ups, and they haven't been able to do any handstand push-ups because of their shoulder pain. And after 4 sessions, their shoulder pain is gone. Great. Let's look at the handstand push-up technique. Let's see what else is going on there. Let's work on our gymnastics. Let's work on our core strength. Let's work on our muscular endurance. Let's work on our overall strength in our upper body. Like there are so many like other things that we can continue to work on to help our clients address their goals. It doesn't just the things you can help with, they don't just stop. You have so many tools available to you to continue to help your clients. And, like as long as you like working with them, they like working with you, and there are still goals to work towards, make a plan to work together. That's okay, And I've also found that people, who sign on for a package for like one kind of complete offer rather than session to session open-ended forever, they tend to get better results because there is a plan, and people love a plan. So, that's why I think it's a good option to do, as long as it makes sense to you, makes sense to, the business that you're running. Sell a complete plan of care and go from there. Anyway, so those are a couple of things that I really wanted to go over. I cannot say it enough, like yell it enough from the rooftops. It is your responsibility to be a leader in this relationship with the client and make your best recommendations about what they need. Remember that it's a discussion. You're not forcing them to do anything, but you are a doctor, you're an expert, and act like one. You know what you're doing. And if you don't, you know how to figure it out, right? Like we know how to do research, we know how to talk to other professionals. We can figure things out in order to help this patient. And like ultimately, the more assertive and clear that you are, the more trust you are going to build with a patient because you are being honest with them and you're being kind, and they're going to get the best results at the end of the day. If any of this resonated with you, please leave a comment down below and let me know. If you are a PT or a healthcare provider who is wanting to start and grow your own practice, or maybe you already have and you're struggling with the sales aspect, definitely reach out, schedule a consultation with myself or my assistant coach, Sam. We do have a few spots available for our business coaching program, and this is the exact stuff that we talk about in the program to help you go from feeling, like not confident, wishy-washy, feeling bad about selling things, to confidently offering your services so that your clients get the best results and ultimately feel better in the long run. And we'd love to help you with that if that's something that you're interested in. The links will be down below in the description. But again, my name is Morgan, and we run the DPT to CEO program to help you build a successful solo practice. And I'll see you on the next episode.